Good morning, all. Myself, Dr. Govardhan, I'm professor in Department of Dermatology. Today, we are going to discuss about the two topics, means scabies and pediculosis. So first, we'll start with the scabies. What is scabies? Scabies it's a contagious disease. It is caused by Sarcoptes scabies varronis. It's a mite. Which mite? The name is scientific name is Sarcoptes scabies varronis. The disease is first for which positive agent was discovered in the history. So it's a very good old in the history of our human body. Okay. And it's an ectoparasitic infection of the skin. And it's classically presents with nocturnal itching. Nocturnal itching means itching is present mainly in the night times. And there will always be positive family history. And classically, what you will see burrows and papules commonly involved in the circle of fibro. So this I'm going to explain in the future slides. So okay, there are two main kinds of scabies, human scabies and animal scabies. First, mainly we'll discuss about the human scabies. So human scabies is also called 7-year itch. The name is given like that. Okay, it's not literally 7 years, but itching will be there. The severe itching will be there. And scabies is it's a contagious disease, and it's caused by the mite, as we discussed. The name is Sarcoptes scabies or ammonis. The first disease for which a positive agent was discovered means, as we already told, it's a very old disease. Okay, coming to the life cycle of the mite. So adult female mite is larger than the male mite. Means the size of it is 400 micrometers. Means the male mite is size is less than this. And it is having a whole body and 4 pairs of legs. I'm going to show the picture next slide. The adult male mite dies after copulation with the female mite. Means after the copulation, the adult male mite dies. The female will continue. The fertilized female mite excavates a burrow in the stratum corneum. Okay. Come to the life cycle. The life cycle is 30 days, around 30 days. And the female might lays eggs at 2 to 3 eggs per day. So and these eggs will hatch into the larvae in 3 to 4 days periods. So the larvae are transformed into nymphs, and these turn into the adults. So this whole process will take 14 to 17 days. Okay, the maturity, that means the whole process will take around 14 to 70 days. On an average, human adult has 10 to 11 mites and an infant has 20 mites. Means always immunocompetent male adult means immunocompetent person is having 10 to 11 mites, and infants will have 20 mites, little more. And all as we have already mentioned, these are female mites. Female mites, male will die after the copulation. So in this diagram, this is in scraping in a wet mite. We can see adult female mite. This is upside down. So as you see here, in the front there are 2 pairs of legs, and in the behind there are 2 pairs of legs. So there are total 4 pairs of legs and oval shaped female mite. So okay, in this picture you can see the eggs of the mite. Especially in this picture, you can see the mite larvae inside the egg, one egg on the right side. Go ahead. Okay, coming to the life cycle. So the incubation period of the scabies. What is the incubation period? First time, how it spreads before going to the incubation period. How it spreads means transmission. Transmission is mainly due to the close contact or due to fomites. Close contact means touching one into other, like shaking their hands, sleeping together, like that it spreads. And second one is through fomites. What is fomites means? The articles. Any article we share each other, like towels, handkerchiefs, we share each other. Means with the help of those towels, this disease will spread. So these are called fomites. Okay. So in any method, it will spread. Even in sexual contact, it will spread. So sexual mode also, it will spread because we come in close contact. The first episode usually takes 4 weeks to manifest. Even though the life cycle maturity takes 14 to 17 days, it will take usually 3 to 4 weeks to complete that life cycle. So subsequent episodes means already the antibodies are there. Means again reinfection happens. So in 2 weeks only, patients will see the symptoms like itching, nocturnal itching. Okay. And where there are overcrowding and poor hygiene patients, the spread is much more, as we all know. We already discussed transmission is through contact. Coming to the clinical features. Clinical features mean symptoms and signs of the disease. What are the symptoms? Symptoms patient comes mainly with the nocturnal itching. Nocturnal itching means patient is having severe itching in the night. And there is always a family history of scabies because it spreads from one person to the another. And the characteristic lesions, what we see in this disease is burrows. We are going to explain each in the future slides. So, what is nocturnal itching? As we already told, it is in the night because itching is present mainly in the night. Morning also it will be there, but less it is there. It is due to hypersensitivity reaction of the mite and its scabella of the body. Okay. So, it produces the itching. Okay. What are coming to the burrows? These are burrows are mainly produced by the female mites. So, these occur mainly on the finger web spaces, the flexor aspect of the anterior axillary fold, the nipple area, umbilical area, and genitals of the men. These are the common places where you can see burrows. They appear, how they appear as fine arches, S-shaped blackish threads are few millimeter long. Often these papillovesicles is visible near the blind end of the burrow, where the mite is situated. Okay. So what you see in this diagram, this is the in the high power, what you can see here, you can see the entry of the mite and it is going in a curved pattern. At the end, there is small papillae or projection. Here only you can see the mite position. Mite will be present here. So it is a different angulated, means little A shape it is forming. Clearly it forms. Usually which place of it forms? The burrows usually is in the stratum corneum or subcorneal layer. You can see maximum, that's all. The superficial part of which places we'll see mainly in the finger web spaces, wrists, cubital fossa, anterior axillary fold, nipple area, umbilicus, and genital area. So in these areas, we'll see the burrows. So this picture, you can see the wrist, presence of multiple burrows in the wrist area. Okay. This is the cross section, H&D section of the histopathology section, where you can see cross section of the mite. As you see here, the cross section of the burrow is situated in the superficial part of the epidermis, means stratum corneum or subcorneal process. You can see the parts of the mite here. You can see in the cross section of the mite in this diagram. Okay. Coming to the clinical features, the most worrying to the patient is, as usual, what you are told, it's a papular pruritic eruption, means it's very severely itchy lesions will be there, means papules will be there. Papules means well circumscribed, raised erythematous skin lesions of less than 5 mm diameter. So they will be present most commonly initially over the web spaces, wrists, cubital fossa, anterior axillary fold, genital areas, umbilicus, these areas. Okay. This itching is, as we already told, it is due to the result of hypersensitivity reaction of the mite and mite's products. Mite products, that's called scatola. Okay, what you see in this patient, as we already told, you can see papules, and A-shaped burrows. These papules will be initially present in the places of abdomen, lower portion of the buttocks, axillary folds, and elbows. So, in this slide, what we can see the circle of infra, means the main sides of the scabies mite where it selects like web spaces of the fingers, wrist, cubital fossa, axilla, nipple, umbilicus, and genital area, groin and genital area. So this imaginary circle where mainly you can see the lesions in the initial part of the disease is called circle of Hebron. Okay, circle of Hebron. You can see in this in the diagram. Okay. So now we'll come into the scabies in the infants. So there is few differences of the scabies in the presentation, clinical presentation in adults and infants. What are this? What we saw here in adults, we see mainly lesions over the web spaces, closed areas, and folds. mainly. So in the circle of fever, usually arms, shoulders, face, head, all these things are spared. But in the infants, immunity of the person is comparatively less. Here in infants, there is a widespread involvement, including face, scalp, arms, shoulders. All these areas are involved. This is the main difference in the clinical presentation of adults and infants. Of course, there will be definitely itching will be more. In infantile means you have to see even with the mother also. Definitely there will be itching will be there, infection will be there. So always you have to examine both the infant as well as mother. So and if it is lesions are not there, you have to search. It is not there also, you have to treat the mother and other family members also. So it is very, very important because it will spread from one person to another person, definitely. So as you see in this patient, so the cheeks means face is also involved in the infants. You can see papillary lesions all over the tongue, axillary fold, umbilicus area, and involvement of the cheeks also. Okay, going ahead. Okay, this in the infants, the vesicles are common on the palms and soles, as I already told. The highly characteristic of scabies of the infants. So if you see the lesions which are present, palms, soles, other areas, and also involvement of the face. These are typical lesions of the scabies in infants. So in this diagram, you can see blood spaces of the fingers are involved. You can see erythematous raised papules mainly present over the blood spaces. Also, after a few days, these lesions you can see over the spreading to the upper part. Means dorsal aspect of the this means palms also. See in the flexor aspect, you can see the lesions also, but number of lesions will be more concentrated in the finger wet spaces and also lateral aspect of the fingers. Okay. So as we already told, this picture depicts involvement of the genital areas. So as you all see in the penile shaft, you can see multiple excoriated papules and nodules, means multiple scratched, raised skin lesions over the genital area, means shaft of the penis. Even in the scrotum also, you'll see lesions. So this is the site mainly initially only these lesions will appear. These are due to hypersensitivity of the reaction of the body to the itch mite and its products. This is very, very itchy. Nocturnal itching will be so severe. This genital in this picture, you can see genital means papules and nodules of the penile shaft and also the scrotum. So coming to the other variants of the scabies means other presentations, other variants, nodular scabies. We already told in some cases itching nodules will persist for several months. It means after treating also, these nodules will stay for many months because these are hypersensitivity reaction of the body to the mite and its products. So sometimes this will stay for usually weeks and months together. And most commonly, these papules and nodules are seen in the genital area like scrotum and the penile shaft. Okay. In this picture, you can see nodules over the scrotum and also penile shaft. This is about the nodular scabies. Coming to other type of scabies means Norwegian scabies. So the other names, what are the other names given to the Norwegian scabies? It's also called crusted scabies or hyperkeratosis scabies. I'll come to it why it is called so. So usually this Norwegian scabies is severe form of the scabies. Most commonly, this Norwegian scabies occurs in patients with neurological disorders, epilepsy, immunocompromised patients, then patients like Down syndrome, patients affected with HIV, chronic antibiotic therapies, renal transplant patients, chronic bedridden patients. Such kind of patients are involved. Old age. In these patients, what immunity is reduced. So where there is immunity reduced, the infection will be severe and reaction of the body also. So the involvement also will be much more. That is why it's called prostate scabies. And what you can see here, you can see widespread erythema, hyperkeratosis, and crusting, but no obvious burrows. Means widespread erythema. What is erythema means? Redness almost all over the body. Hyperkeratosis means thickening of the skin. It is due to reaction and chronic scratching of the skin. This causes thickening of the skin. This is called hyperkeratosis. And crusts are formed, but no obvious burrows. Since extensive body surface are involved, burrows you may see, may not see because the area will be spread. In this piece and in these patients, The number of mites, very, very important points. You can see innumerable mites. It may be 1 million sometimes. So usually in immunocompetent patient, you will see 10 to 11 each mites, means female mites. In these Norwegian studies, due to less immunity or no immunity, there will be uncontrolled multiplication of the mites. You can see even 1 million mites, innumerable number of mites in these patients. So this in this picture you can see what multiple or diffuse crusted lesions teeming on the with the mites with the anesthetic and deformant of the leprosy patient. Leprosy patient immunity is also less, and also there will be no sensation. So there will be extensive multiplication of the mites and body reaction will be there. So you can see extensive involvement with the hands and forearms. You can see. Similarly, in this picture, involvement of the front gluteal area, both lower limbs, you can see on the legs and feet also, you can see. So there is an extensive involvement of the all over the body with extensive scratching. The sting is formed. Eczema you can see here on the trunk, scratching and crusting and hyperkeratosis, pigmentation, all these things all over the body you see. Okay. In these patients, since no immunity is not over, patients will not feel any itching. Itching will not be there. As there is no immunity, the reaction will not be there. So itching will not be there. But patient is continuously suffering with the disease. Definitely, it is very contagious. Okay. Coming to the animal scabies. What is animal scabies? This animal scabies is also called pseudoscabies. What is pseudoscabies means? Why it is called pseudoscabies? So usually animals get affected. Means dogs, all pet animals like dogs, cats, birds, all will get affected. Okay. So usually we'll come in contact with them. So which part of the body comes in contact? So usually we carry them so that the palms, flexor aspect of the forearms, arms, our anterior aspect, trunk, and upper thighs. These areas will get come in contact with the pet animals. So you will see hypersensitivity reaction of the body, like itchy papular eruptions, erythema, localized to site of these areas, like where animal contact with the human skin will come. And usually these eruptions are self-limiting with no burrows will not be seen. And here, very, very importantly, patient comes with itching in these areas only. So we have to suspect that we have to ask the history in these patients, like any pet animals are there or not. If they are there, if they are suffering from any lesions, definitely we have to treat the animals as well as treat the owner, means person also concerned. So anti-scabies treatment we have to do. Simple treatment as well as anti-scabies treatment for the animal as well as the owner. Both are to be treated. That's since you won't see the scabies mite here, in the person, you will see scabies mite in the animal. That is why it's the pseudoscabies or animal scabies. Coming to different special forms of scabies. What are the different special forms of scabies? At least to start with, scabies in the clean persons means scabies of the clean. In this patient is having nocturnal itching and itching all over the body, but unfortunately, there are no skin lesions, no erythema, no papules, no burrows, no lesions over the skin. Whatever you see, only patient will present with symptoms. And there are no skin lesions. That is why the name is given, say scabies in the clean, or scabies of the clean. And similarly, scabies incognita means patient is not treated for the scabies, but definitely with anti-itching drugs and steroids so that all the lesions will get suppressed, but itching will be present. That's why it's called scabies incognita. So, and nodular scabies, we already discussed. Scabies in infants and small children. This also we have discussed. In infants and small children, mainly a difference is involvement of the face, skull, palms, and shoulders, along with other places in of the subtala fibula. Scabies of the elderly. This also we discussed. Tested scabies are Norwegian scabies. And scabies of HIV and AIDS. These are also similar to Norwegian scabies. Scabies in the atopic dermatitis patient. Atopic dermatitis also means the superficial layer skin is dry. There is no protection since this is little extensive in this patients. Animal transmitted disease means those pseudoscabies are animal scabies. Scabies are called dishydrosiform scabies means usually constant source are mainly involved. Articulating vasculitis scabies means lesions, skin lesions here are present with urticaria means raised heaves and also vasculitic like lesions of this skin. That's why it's called urticarial vasculitis scabies. Bullous scabies. Why the name is given as the name says. Here we see papules, pustules as well as bullae will see. So that is why it is called bullous scabies. Usually these bullous scabies will see in kids. and elderly also sometimes, where immunity is slightly less. So these are different special forms of the scabies. Okay. Now coming to the complications. Before going to the complications, some investigations will do. What investigations will do in this patient? KOH mount. KOH mount scraping you will see. You see if you scrape the lesions and see put KOH or saline mount, you will see. If you see in the high power microscope, sometimes rarely we may see the female mite what I have showed previously. You may or may not see. Very difficult to see because very rarely, in my experience, I have seen only once or twice. That's all. Otherwise, very difficult to see this, identify this mite, to find this mite. It's very rarely seen. That is one thing. Otherwise, clinical examination. You see involvement of the clinical examination, other family members involved, family history, nocturnal itching. And this, based on the history and examination, we will find diagnosed as a scabies. Okay, now coming to the complications. What are the complications? Most commonly, first, secondary infection. Because of itching, we will scratch. Secondary infection, most commonly, streptococcus. Then, post-streptococcal glomerulonephritis. If you don't treat properly, especially more commonly in the kids, kids are more prone to get post-streptococcal glomerulonephritis. It's a very severe condition, as we all know. Rarely it can go for even renal failure also. And eczematization. What is eczematization? Is severe involvement of the other parts of the body and spread to the other parts of the body. Okay, it is called eczematization. So, in this picture, you can see papules, pustules, you can see, and erythema. All these things you can see in the finger spaces. Means already papules are there, which secondarily infected with, and because of that, we will see pustules, pustular lesions. That is why it's called secondary infection. Most commonly, patients will present like this many times. You should not get confused that only you should not treat for a secondary infection. You have to treat, definitely keep it in mind, scabies, and call the patient, follow up after 5 days, and treat the patient. So in this picture, you can see the leg of the infant. What is present? Erythema is there, explorations are there, as you see, and few papules are also there. Means diffuse erythema, scratching means explorations, papules, these are spread all over the body, and skin is also out of it. Means dry skin. Dry skin is there. So eczematization is the leg, not here. Similarly, such kind of lesions you can see all over the body also. It may be in severe conditions. Okay. So coming to the diagnosis. Diagnosis I already told. Clinical history and examination. History of nocturnal itching, and similar kind of itching and lesions present in other family members, and localization of the lesions like in circle of fibra, and confirmation of the diagnosis by demonstration of burrows, mites, and mite products such as K-ball-X, etc. Means burrows will be there. If you scratch or scratch a burrow, take a scrapings. You can see some rarely you can see in wet mount. You can see the mite. And also you can also demonstrate this burrow with the help of India ink. India ink you pour there in the site of your spaces. Slowly leave for some time. It will get absorbed and wipe it off with the saline. And if you examine, there will be a shape. Means the India ink would have gone seeped in through the S burrow. You can see the A shape of the lesion in the wet space. Like that also you can demonstrate the burrows. Like this, you can diagnose. So coming to the treatment as well. Who do you treat? Mainly treatment is topical as well as systemic, and also treat complications. So starting with topical treatment. Main drug of choice for treatment is permethrin. It is 5% permethrin cream or lotion you have to use. How to use? We have to use 5% permethrin. 30 ml is enough to cover whole body. Means how to apply? You have to apply below neck and below the ears, all over the body in the night, and you have to leave for overnight. Means minimum contact period is 8 to 12 hours. And after that, scrub bath you will take in the morning. If required, similarly, you have to repeat the same application after a week or 10 days. Okay. And this permethrin can be used safely within patients above 2 months of age. Below that, it's not advised. Other topical agents like 1% benzyl GABA means gamma benzene hexachloride. It's also called Indian. Single overnight application is enough. Others are benzyl 25% benzyl benzoate. And in kids it is 12.5%. And how it is applied? Usually 3 applications at 12-hourly intervals all over the body without intervening bath. Should not take bath. Like that benzyl benzoate is used. So other options, most commonly in the kids as well as pregnant ladies, is precipitated sulfur, 6% reduced in petrol atom. Once daily for 3 days, you are to apply. 10% photomaton cream, most commonly it's used in the kids. Very safely it can be used in the infants and pregnant women. Also, it also acts as an antipruritic agent. Other is monosulfuron, and it's also available as a soap. Usually, it's given for infant, pregnant women. Sulfuron photomaton, as I already told. Cream lotion is applied all over the skin below the neck and including the face in case of children. Always remember, in infants and children, as the lesions are present in the scalp, face, palms, and soles, you have to apply, cover all these areas. You have to advise the mother to apply carefully. From the systemic therapy, most common anti-scabies, anti-mite is ivermectin. How much is ivermectin is used? Usually it is used 200 microgram per kg body weight. Single dose. If required, repeated after a week or 10 days, one more dose. That is more than enough. Then other part of treatment is symptomatic treatment. Means the patient is having severe itching, so we have to give antihistamines. And treatment of secondary infection and eczematization. So we already told complications also, if it is there, you have to treat. Means antibiotics you have to give, and eczema is there, we have to give it antipruritic and topical, local as well as systemic drugs. And very, very important, treatment of other family members. If you don't treat, definitely it will spread again and it will rotate among themselves and suffering will be much more. So, and very important thing, what we will advise the patient is cleaning and washing of the clothing and bedding. So, advise the patients and their attendants, their clothing and bedding, they have to launder it very properly, and we have to wash them, soak them overnight, wash them, and make them dry in the hot sunlight and iron them properly so that any mite is there, this will wash. Each time when they do, means 2 times, they have to do this procedure. Like this completes the scabies. Now we'll come to the pediculosis. So, what is pediculosis? Okay. Pediculosis is infestation with the lice. Lice are ectoparasites, as we already know. So, what commonly we call infection, what we all know is most commonly scalp or scalpels are involved. Okay. These lice are wingless insects having 3 pairs of legs. There are 3 kinds of infestations. Mainly, to start with pediculosis, humanis var capitis, that's head loss, then corporis, body loss, and psoriasis, pubic loss or crab loss. There are 3 types. Coming to the life cycle. So usually here also the female lays approximately 6 eggs or nets each day. The eggs hatches in 8 to 10 days and reaches a maturity in approximately 18 days. So nets are glued to the base of the hair shaft. But I will show you in the next coming slides where they are attached with a very clear picture. Also, but the incubation period here, incubation period is again 3 to 4 weeks. It will take. So how it spreads after contact, close contact, and also through the fomites. Similar to the scabies, this also will spread. Okay, after close personal contact and contact with the objects not shared by others, let's call fomites. As we are doing. First, we come into the pediculosis capitis. Pediculosis capitis is a lice infestation of the scalp, most commonly in children, especially girls with a long hair. What you commonly see, we all know in the schools, kids, most commonly in any house, most commonly. One or the other in our lifetime, all would have suffered from this definitely. Okay. It's most commonly present with itching and secondary burden scalp, other present on there. Then how to diagnose might be seeing the lice on the scalp, and also more commonly nits are glued to the hair shaft. Okay, I'll show this in the pictures. In this picture shows the pediculosis immunis capitis means it is a very long oval mite. You can see. Okay, with head loss. So, as I already told previously, unnatural knit attached to the shaft of the hair, lower part of the hair with the help of the chitin. It is a glue material called chitin. Okay, inside also you can see the knit, means larva. So this is in an angle, it attached to the hair shaft with the help of chitin, glue material. Okay, in this part you can see the antidote, upper part of the net means glue net is cut off and we could have larva has come out. This is attached to the hair. In this picture you can see this. In this picture, you can see extensive, multiple, these nets attached to the hair shaft. You can see extensive infection, severe infection, numerous nets. How to treat this? How to diagnose? Diagnose, we know clinically what you see, and also other family members also involved. How is that we will diagnose and treatment. In this case, 1% permethrin. There in scabies, we use 5% permethrin. Here, 1% permethrin rinse is enough. How to use 1? We have to apply 1% permethrin cream over the scalp, leave for 1 to 2 hours, then scrub bath. Yeah. And other agents are, as we have mentioned, gamma benzene hexachloride lotion or shampoo. Malathion, protometon is also effective. And usually we have to repeat the treatment if necessary weekly or 10 days. As needs may not be killed with the pediculosis cancer. Okay. Treatment of secondary infection. We already told secondary infection have to be treated with antibiotics and anti-inflammatory agents. Since it spreads from one person to another person, other family members should also be treated concurrently. Then coming to the second part, pediculosis corporis means for body part means trunk is involved here. Okay. So this is also called Govardhan's disease. Here the body lies, leave and lay their knits in the seams of the clothing. Seams means the inner side of the stitches. Okay, you will see the body lies. And return skin surface only on the feed. Means they will come to the skin and feed and go back and stay in the seams. I will show in the picture. Okay, this induces pruritus that lead to scratching, pigmentation, secondary infection. Definitely, body reaction will be there. So, edema, itching, scratching. Because of that, hyperkeratosis, pigmentation, all this happen. If you don't treat properly, so upper area of the body where accessible parts, like the scapular area, upper back, lower back, these are all extensively scratched areas, hyperkeratosis, pigmentation is seen. So that is why the name is given Vagabond's disease. The body loss is the largest, and crab loss is the smallest as well. Okay, I'll show the crab loss also. Body loss is the biggest one, similar one, oval shape, short whole body, prominent claws resembling the sea crabs. Lice feed by piercing the skin and their claws, injecting their saliva, irritating saliva and sucking the blood. Okay, seems they will hang on, then they will suck the blood through the skin by injecting the irritating saliva and suck the blood from the body. This is the picture of the pediculosis luminous corporis, as we have seen, similar to the pediculosis cactus. Yeah, whole body, but the size is bigger one. In this picture, you can see the seams means where there are stitches are there. In these corners, where you can see the presence of this loss, body loss. Very typical picture, nice picture. How do you manage? First, before for management, you have to diagnose, establishing the training of gloves and nets in the seams of the clothing, as we already told. And you have to treatment is simple laundering and ironing of the clothing. And if you want anti-mite like ivermectin 1 dose also can be given. And symptomatically, you have to treat with antihistamines. That's very, very important. Okay. Coming to the pediculosis pubis, means crab loss or psoriasis pubis. Third one, final one. Usually it's contracted with by adults, usually the sexual intercourse, most commonly sexual nerve, because pubic area, genital region, the adjacent parts like upper thighs, rarely axilla and eyes are also involved, very rarely. It's called pediculosis palpabrum. So itching and crawling sensation will be present in the patient. But I will show in the picture. Patient. Now to diagnosing black speck-like bodies attached to the roots of the hair and strapless. The roots of the hair you will see black speck-like things. This is the picture of the serous pubis, means crab loss or pubic loss. Here you can see small black dots in the roots of the hair shaft. Okay. These are the crab loss in the pubic area. In the hair magnification, as you see, this is crab loss present in the pubic area. This crab loss present in the black dots. You can see the axilla, roots of the hairs. These are the crab loss present in the axillary. This is the involvement of the eyelashes. You can see eyelashes. These are knits are attached to the hairs of the eyelashes. Then occasionally, in fair-skinned people, one may encounter gray-blue macules or macular septa. What is the gray-blue macules? These crablows will crawl along from the genital area to the adjacent side, like luteal area, lower abdomen, and upper thighs area. And this, you can see gray-blue macules, as you see in the picture here, gray-blue macules. These are called macular cilia. This may vary in few 1 to 2 centimeter in the size. May be seen in the groin, lower abdomen, and upper thighs. Coming to the treatment part. What is the treatment part? Similarly, you can see a treat with the permethrin or gamma-benzene hexachloride. Another treatment is, since they are attached to the hair shaft, simple shaving of the hairs will also clear the treatment. And we have to remember, as the disease spread through the sexual route, we have to treat the sexual partners also. Very, very important. Otherwise, usually it spreads. Okay. Coming to the end. So, in this class, we have discussed scabies and pediculosis, two topics. I think understood both the topics. Any doubts? Thank you so much.